Hello, and welcome to Talk of the Town. I'm Michael Jacobi, and this is a production of KCAT that we're very proud of. This is our second installment of the show. The show we'll take a look at local events and chat with local people in the news. And tonight we're going to talk a little bit about our community hospital, what that hospital means to our community and what the community means to them. With us, the Executive Vice President of Camino Hospital, Los Gatos, Pat Wolfram. How are you?
Good, how are you?
Nice to see you. And Dr. Tony Masri, we're going to screw that up all day anyway, who specializes in sleep disorders.
Correct.
Now, I'm going to warn you guys, I never have a script, but today I've actually written some questions down, so it's going to make it a lot easier so we don't have to do impromptu. It's not like Second City. First of all, Pat, tell me a little bit about your background. I know you grew up in Arizona? Went to school in Arizona?
Actually, no, Southern California.
Okay.
Born and raised, native California.
But you never left the sun. You went to school
I went to school in Arizona State,
And
yes.
then when you went to Fort Lauderdale.
Yes, and I went to Fort Lauderdale.
Yeah,
Ooh,
well,
we're
it's
looking
like
me
a
up.
constant spring break for you.
You
That's
know what? I
wonderful.
love the sun. I'm a sun person, and I'm a beach person. So,
Okay.
yeah. And I went to Arizona State and actually got my RN, so my bachelor's as a registered nurse, and then got a master's in health, adult health, and then my MBA when I was in Florida.
Okay.
So, I love healthcare because it's helping people, and that's what really attracted me to actually go into the hospital business.
Well, Los Gatos is hardly a hop, skip, and a catching a wave from Fort Lauderdale. But what brought you here?
Actually, I was recruited.
Okay. Nice.
So I was doing some consulting as a CEO at another location, and then I got someone who recruited me up here. And actually, I had some friends up here, and I came to El Camino and looked at it. And we were reopening Los Gatos because El Camino had just purchased it in 2009, April 2009. And so it was like a great opportunity and a beautiful community.
Yeah.
And I had never lived in Northern California before, only traveled through it. So I'm addicted.
Yeah,
Yeah.
it's worked out.
It's worked
I'm
out
glad
really
you-
well.
Dr. Masri, tell me a little bit about your background. Where are you from?
So I'm originally from Lebanon. I came
Okay.
to the U.S. when I was 17 after high school, and I went to college and medical school in Ohio. And then following my training, I went to did my residency training in neurology in Cleveland. And what brought me to California was Stanford. I wanted to do subspecialize in sleep medicine, and I came and did my training at Stanford.
Lebanon was a cosmopolitan area of the Middle East, and obviously it's gone through so many changes. You get back?
Yes, I actually
Your family
visit.
still back
Yeah, I
there?
have family there. My father's side of the family, for the most part, is still there. My parents are there. I visit every few years. My wife and I visit together.
Now, is there the medical training in Lebanon? Is that something that you can do medical school there?
You can. There are
Because
actually
it's
there
tough
is an
to
American university in
Okay.
Beirut, and there are a lot of some of my friends who I went to high school with stayed and went to in Lebanon and went to med school there, and some of them came and did residency training here. I did all my training following high school in the U.S.
Now, sleep disorder. I've got to believe that's a relatively new science. I know my father, I'm sure, said, I just don't sleep well, and just chalked it up to the way life is, that there wasn't anything he could do about it. But it's really emerged.
Correct. So sleep disorders in general, the first sleep clinic in the country was at Stanford in the early 70s. So that's early 70s for a field is very new compared to a lot of other fields have been much more developed. So we're learning more and more about the impact of sleep as the research progressed. For example, we only found out that sleep apnea, for example, can affect cardiovascular health and raise our risk for heart attacks and stroke in the late 80s. And it was, again, at Stanford, and it was followed by more studies that were done nationally and internationally.
Define apnea for me.
That's a great question. So apnea is basically a pause in breathing or slowing down in breathing when someone's sleeping, during sleep. So when we're awake, we obviously don't snore, we're walking around, our airway is open, we're using our accessory muscles for voluntary control, we're breathing normally. When we fall asleep, there is a propensity in some people to have the airway collapse occasionally, and we have a narrowing. That's why that snoring sound comes about, because we have our airway is not completely open. Sometimes it completely closes for a period of time. It's not unusual for it to close for 20, 30, 40 seconds. Someone has apnea, even over a minute. And this is where sometimes the bed partner is alarmed and notices this gasping sound that happened afterward. That's basically the tip of the iceberg. But for every time something like this happens, there could be 20, 30, 40 times where our breathing is abnormal when you're sleeping. It's kind of like choking.
Okay. Now, if I mean, obviously, there's a time limit on that. If we go up to 2 minutes or something, I mean, is there an adult death syndrome that happens?
Well, what there is, there's a mechanism in our body to respond to that, because our brain is designed in a way that breathing takes precedent to sleeping. So what our brain steps in and sends signals to the heart and to the lungs and sort of revs up our sympathetic response, kind of like the same thing would happen if you held your breath in the pool,
Right.
and you feel like your heart rate goes up and you start, your sympathetic nervous system, that flight and fright response happens. And that response basically interrupts the sleep for microseconds, sometimes a very short period of time, and then causes this increase in blood pressure. The blood pressure can go up from normal to 200 plus. Heart rate can go up from normal to 150, 160, 170, even much higher than that. And it's basically the brain has a way of correcting and helping opening up the airway. Now that correction doesn't come at no cost. It comes at a cost on the body in terms of raising the blood pressure, disrupting sleep, causing us to feel tired, sleepy, causing things like poor glucose control, increased blood pressure. A lot of problems can come from that.
Now, lower, because I just recently went on blood pressure medication, and I was, I don't know, 165 or something, whatever Roosevelt died at. But it was very high, and it's gone down dramatically. Should that have an effect on sleep? Because I have problems with sleeping.
Correct. So problems with sleeping can be a lot of different things. Apnea, there's a big relationship between apnea and high blood pressure. In fact,
Okay.
50% of people who have 30% of people who have high blood pressure also have apnea, and 50% of people who have apnea have high blood pressure. And we understand this better now, the relationship between high blood pressure and apnea. What we understand is, for example, especially in patients who have severe high blood pressure, meaning they need to take more than two blood pressure pills. We call that treatment-resistant hypertension in our world. So if you're taking 2 blood pressure pills and you're still not having your blood pressure under control, you have 60 to 80% chance of having apnea. Not only that, but if we treat your apnea, you're going to respond, your blood pressure is going to respond and come down.
Okay.
Especially in that population. So there's that connection that we see that.
But as opposed to treating the blood pressure.
No, treating the blood
With
pressure
the apnea
is essential.
going down.
However, I see several of my patients who get treated for apnea, then they either go down on the dose of their blood pressure medications,
Okay.
and I've had a few occasions where they don't need the blood pressure medicine.
Pat,
Yep.
one of you, obviously being in this business, you are a very interested person. And it must be a joy to be working with all these folks that every turn literally you make, it's a new subject you can chat about and learn.
Oh, absolutely, absolutely. I mean, just listening, to Dr. Masri, I was going, oh, I didn't know that,
Yeah.
that point. And he recently started this program at Gatos and became the medical director and has just enhanced it, made it our gold standard sleep program, and it just has grown and is thriving. And just when I started reading up on it and listening to some of the things he was saying, it's amazing.
Yeah.
We learned so much that people don't realize when you snore and what that means, because we just don't. But you wake up tired.
Yeah, I think our culture for the longest time thought, we still do to some extent, think of snoring as cute or as something that's sort of a sign of deep sleep. In reality, it could be a sign of something that can be lethal, and something can be at least impact your quality of life. We a lot of times we tend to feel like tired in the afternoon or sleepy. We feel like maybe we're not our usual self back in our 20s or teens, when in reality it's just snoring is not a usual thing. We don't have to live with that. If we treat this, we feel better. What I offer with my patients is an opportunity to have a better quality of life, be able to better concentrate, have more energy during the day, improve. Even there's a big impact on sex life when in men and women when it comes
Sure,
to
if you're
improving
awake.
sleep. Well, not just being
Oh, I'm
overweight. Also, when you have interrupted sleep, it can really impact libido and also can
Yeah.
impact erectile dysfunction. Our sleep standard started, like a lot of programs in El Camino, started from a medical need for the community. El Camino realized that we need to offer help for our patients who are struggling with sleep disorders, because we see that impact on their health when they come in to see us for blood pressure, when they come in to see us in the men's health program, whether men are having erectile dysfunction or whether they're having, we see them having the end result, which is sometimes stroke or heart attack, and they come into our emergency room. We're thinking, what can we offer these patients long term prevention, primary prevention and secondary prevention. And this is where the science of sleep medicine comes to tell us what can we do. And there are treatment options that are very effective. That's where the center starts.
Excuse me. I would think the great misnomer, when you ask someone how are they sleeping, they base it on hours
Yeah.
as opposed to quality of sleep. Oh, I get 8 hours a night because I'm awake every 20 minutes. And the idea of the great catch-all word of insomnia. I'm an insomniac.
Okay.
When no one has a clue about what it really means. Does insomnia exist that can't be treated?
Well, the insomnia, first of all, exists. It's common too. It's another thing we treat. We talked about apnea, we talked about insomnia, and we have very good treatment options.
Okay.
My message, one of the reasons I love sleep medicine as a field, one of the reasons I went from doing just general neurology to sleep medicine is because we have solutions for patients, and we have treatable conditions. The most common conditions I treat are apnea, insomnia, restless legs. You don't have to live with them. With patients, you don't have to live with it. It's a real disorder. We have good medical treatment options. And for insomnia, which is common, it affects about 10% of the general population at any given point. It's not unusual that up to 40% of people have some insomnia throughout their life.
And there again, that is defined as not sleeping through the night?
Let me define it. So to make it the simplest way, insomnia is trouble falling asleep or staying asleep.
Okay.
And not only that, but it's trouble falling asleep and staying asleep with an impact on your next day life. That's a very clear distinction. If someone comes to tell me, doctor, it takes me about half an hour to fall asleep, I say, does it bother you? No. Do you feel great during the day? That's fine.
Yeah.
If they say, I'm having trouble falling asleep, I worry about going to bed, it's always a struggle, I cannot shut off my mind, and if I happen to wake up in the middle of the night, I cannot fall back asleep, and I feel lousy the next day, that's basically insomnia. Now, there could be other comorbidities, unfortunately. Comorbidity is another big word we use basically for saying other medical problems that are making the insomnia worse. One of them, for example, is apnea. It can wake up the person several times because they're not breathing, but then now insomnia kicks in and they can't fall back asleep. And we do have very effective treatment options for insomnia, whether it's medications like pills, prescription medications. That's very good in the short term, but something even better in the long term, which is a program we have here. It's the gold standard of treatment. It's called cognitive behavioral therapy. And this is something we do. It's not common outside of big academic centers. And I've been lucky to train to do this at Stanford and be able to bring that to the community. We do this on a regular basis. We have great outcome in terms of we track how well our patients do in 3 months, 6 months, and a year.
How good is he? He used the word knowing that I wouldn't understand it and then defined it. This is a great doctor. Strangest case you ever had?
Well, there are very interesting cases, and it
Without
depends on what you
names.
mean strange. So there are, define interesting, that's another thing. For me, interesting for me as a physician might be different. That's what's interesting for, I've seen, what we treat is we treat the common disorders, such as sleep apnea, insomnia, and restless legs, but I also treat the more rare, obscure disorders where people act out their dreams, where someone says, I have a dream of catching a football or running to grab a falling child and physically get up and do it. I've had patients who come and see me and say, I've accidentally hit my spouse, one way or the other, or I'm this different person in the middle of the night where I'm yelling and I'm screaming and I'm using expletives, and this is not really me, and I've never done that in real life.
Tourette dreams.
To some extent, something like that. And there are disorders that are unfortunately happen, and they happen as part of a bigger neurological disorder. Some things like there can be sometimes an early sign of dementia, sometimes there can be an early sign of Parkinson's disease. There can be sometimes precede disorder by 5, 10, 15, 50 years is the longest. So patients can come in with strange things. There are parasomnia, which is the whole world of things we do when we're sort of not really awake and not really asleep, like sleepwalking, sleep talking, can be a very interesting world too, and I've had a lot of interesting cases with that.
With that situation, over the years, what department do you find you're most likely to pass on someone to? Because if they're having problems, with the blood pressure, the sleepwalking, or maybe it's a larger problem, who do you normally go to? So
in terms of what we do, the treatment plans, for mostly we have a comprehensive program. So we do work with a surgeon who specializes in sleep apnea. We have a couple of them actually. We work with a dentist who offers solutions of oral appliances for apnea. We work with them very closely. Myself, I my goal is basically sort of to quarterback the process and make sure my patients are followed closely when they go and get treated. And we do work closely with, occasionally work with psychiatrists, but that's not as common. A lot of the treatment with for parasomnias, for example, and the more rare sleep disorders involve either medications or evaluating an underlying treatment. Sometimes the apnea or something common like apnea can manifest, can show up with something more strange, and it looks like a strange seizure or something like that, but in reality it's something we can treat within the scope of what I do every day.
And you're not there yet, but as the rest of us get older and reach seniorhood, we find napping wonderful. I'm a big believer in naps. Is it because I'm rejecting the real problem that I'm not getting enough sleep, or is there value?
Well, naps can be helpful. Defend the question. If the nap is because you cannot, some person cannot get through the afternoon or get through the day without a nap, that raises a question for me. If a nap is sort of a nice quiet time, you meditate, you slow down from your busy day, that's fine. And if it's, as long as it's short and it's not affecting the ability to fall asleep at night, when I mean short, it's 20 minutes or so, that's very reasonable before 4 p.m. because you don't want to take a nap really late, close to bedtime. The question I see, the patients I see, most patients I see that come and tell me they nap, when they get treated for their sleep disorder, they come back to me and say, I don't nap anymore. And my nap goes from every day now to maybe once every 2-3 weeks. If I had a busy hike or if I was up really late the night before, that's when I can take a nap, rather than I cannot get through my day without a nap. Similar to coffee. Coffee is not necessarily a bad thing. It can be helpful to have a cup of coffee in the morning, but if you cannot get through the day without 3 or 4 cups of coffee, or that extra cup of coffee to finish the afternoon project, that tells me there's something wrong with either the quality or the quantity of sleep someone's getting.
You know a story about Bob Hope when he was doing entertaining the troops. He apparently had the ability to fall asleep at will. That he could just get on the plane, boom, and be out for 8 minutes, and just it was those kind of cat naps. But he could control it, and I find that, and I have taken naps. I mean, particularly doing the jazz thing in the afternoon. You know, I may hit the pillow for a moment, but I have found naps as 5 minutes are unbelievably refreshing, and come out of them. I mean, so awake and so much more energized.
Naps can be helpful. Let's keep in mind also that naps is not only a time when you're sleeping. We don't necessarily always go into deep sleep. It's a time to slow down. And when we know slowing down and sort of helping focusing the mind is very, very powerful.
Let's talk about, we opened with talking about the relationship of the community, what the community means to the hospital. I want to ask you that.
Okay.
The community means the hospital, and then I also want you to, perhaps, Tony, you could answer what the hospital means to the community.
Okay.
Yeah.
So what the community means to the hospital is that we're here for the community. And it's always interesting because unless you have had to use a hospital, you know it's there, but you don't really...
But you don't want to go there.
You don't want to go there, but you don't understand what it can do for you until you reach the point that you have to go to the hospital.
Yeah.
I've actually experienced that myself. I've been in hospitals for 30 plus years now, and it's different when you work and then when you're a patient. But when you cannot, you have to go to the hospital, they're there to help. And when I experienced it, I was amazed at how wonderful everybody was and took care of my problem. Not that I wanted to be there, but they took care of the problem. So the hospitals in the community is there to help you. I mean, we have outpatient, we have inpatient, and we're working more on, and this is the positive thing being an RN, is that we're working more on wellness. So we're reaching out to the community and starting to work on wellness because people think, you know, well, I know how to take care of myself, I know how to do all of that. And unless you've really been trained like that, you really don't. And or do you go to the gym, 3 times a week? Do you drink 8, glasses of water? But it's more than that. It's really teaching how to take care of the issues you have so you don't have to go to the hospital. So we're doing this change from, yes, we're always here for you, to a more wellness, and we're there to take care of you.
More proactive.
Proactive. And that's what the community means. So we reach out for all of our community, and when we take care, we have a Chinese Health Initiative, South Asian Heart Initiative, and there's more that we're exploring as our community starts to change, because different nationalities, cultures have different disease processes. So, and if we're comfortable talking with people that are like themselves and understand what their issues are.
Not to get into the whole politics of Obamacare, but is
Our favorite.
We don't have time, but I would think the silver lining of that people now are paying more attention. And
Yeah.
that, I mean, it's got to be a plus.
You
And
know,
with the more available.
I think so, and it is more available.
Yeah.
And which healthcare needs to be available to everybody, and particularly, from children's to the elderly. And so I see that as a positive. And as we continue morphing
Right.
into the Accountable Care Act, I think there's positive things that come out of it. However, in healthcare, it's different for
It's
us.
a work in progress.
It's a work
There's
in
no
progress.
question about it, but would you say we're better off than we were 10 years ago?
It's a change.
It's a change,
And so
yeah.
I think it's good that we're changing, because now one of the things that, our hospital is working on is taking care of the patient 90 days post-hospitalization. And if you've ever been in a hospital, that wasn't happening. You might see your doctor in a week or two, and but then after that, you're on your own. Now, we, as a hospital, are being responsible for 90 days post. So again, that whole conceptual wellness, we don't want you to get back into the hospital.
Let me amend my question to you about community. Let me ask you, why El Camino?
That's a great question. Well, it started out, El Camino recognized the need and importance of having a quality sleep center, and what's the importance of providing treatment for patients who are having sleep disorders, how that impacts overall wellness and health. So when I started working with El Camino, it was that we have this, I came in with this idea of this vision. I came in thinking sleep disorders are undiagnosed. It's probably sleep apnea is the most undiagnosed sleep disorder. The literature says 80% of people who have severe sleep apnea don't know it. And when I came to El Camino and said that, I said, okay, what can we do to help educate our population, tell patients that they can have better quality of life? And they've seen the impact of apnea on patients. So when I came to El Camino and said, for example, the literature, research tells us when a patient comes in for orthopedic surgery, for example, or any outpatient procedure, very simple procedure, these patients have a higher risk, for example, of complications if we don't know they have sleep apnea. What El Camino would say, okay, what can we do to do that? And we were able to set up a screening program for our patients that come in, and instead of these patients coming in, having a surgery, having the complication,
I would
going back.
imagine it's a real issue with anesthesia if you have it.
Correct.
Oh, yes, it
Anesthesia,
is.
yes. It was a perfect example of how I see a community hospital as sort of a partner for a physician. From my standpoint, in my office, I see that the hospital is an extension of services I can provide. There's certain things, only so much we can do in the outpatient office. And the relationship has to kind of start with that intention of how can I help my patient go through from my office, get a service in the hospital. And the hospital sometimes is in a unique position to offer a patient a piece of education, or say, listen, you can go through this in and out of the hospital several times, and it could be a missed opportunity to help catch something like sleep apnea or other disorder. But we're not going to do that. We're going to go beyond that. We're not going to go beyond what we have to do and provide an opportunity to screen you, educate you about this. And what I like about working with El Camino is that going from an idea to implementing a program and being able to adjust as we go is a very smooth process. A lot of times there's giant bureaucracy for a lot of places, and I have not seen that, which has been a great positive.
I will tell you, Doctor, on behalf of the community, we're delighted that when you left Lebanon, you made a left to Paris and ended up here. And it's often said there are two types of people in the world, those that eat well and those that sleep well. And we're handling all of them now, and that's great. We are indeed sharing the health. Guys, half an hour went by in no time.
Thank
We'd
you.
like to see you. We would, you and I talked off camera about perhaps doing more of this throughout the year. Boy, it's a great day for me to learn something as well and to actually listen for a change. Doctor, a delight to see you, my friend.
Thank you. Thank
All
you.
right. Good seeing you. That's the talk of the town. Next week, or the next show, we'll be talking to Colleen Bailey, who's the new managing director of the Monterey Jazz Festival, along with a little buddy, Tim Jackson, who's the artistic director. Find out a little bit of behind the scenes around what's considered by most to be the finest jazz festival in the world. So thanks. Have a great day. I'm Jacobi. I'll see you soon.